to say a hearty thank you to Hector. It's always a pleasure to have people that are energetic and ask all the right questions, and that's what the department is here to support. So I want to thank you for your service and for all of the great work that you did on the commission. Thank you very much. I was asked to give all of you an update on certain issues that face the department this year, and in the interest of time, I won't go over them one by one. You have a handout that we prepared for you that talks about our progress on implementation of urgent care centers, what we're doing with homeless services, our law enforcement expansions, services to transition age youth, and our health neighborhood initiative. And if you have a chance to read this, we were also asked to focus on these initiatives in Service Area 3, and so you have that information. I'm just going to touch on a couple of highlights because there's a lot of good news and great things that are happening in the department, and I want to just touch on 3 of them. First of all, many of you have seen in various blogs and newspaper reports and radio reports that the department and Exodus Recovery, Inc. successfully reopened the Westside Mental Health Urgent Care Center a week ago Monday. That was really a highlight because for those of you that were around and working in the field, certainly the commission members in 2005, you know that the Westside Urgent Care Center was really our first contracted urgent care center that operated 24/7, LPS designated, and they closed about a year and a half ago because they lost their lease on the campus of Field Broughton Medical Center. So to reopen that facility was just a wonderful event. Supervisor Ridley Thomas was there, Dr. Mitch Katz was there, and all of the police departments were there because that facility is consistent with our vision of not only providing timely access to mental health services, support for clients and family members in the community, a way of decompressing the emergency rooms that need support, and a better way of approaching people in mental health crisis, but it's also a place where law enforcement can transport clients that need services instead of incarceration. So that was a really exciting event. So that's number 1. Number 2, we continue to work with District Attorney Jackie Lacey and others on the Jail Diversion Committee. And we actually have 2 successes of the last couple of weeks. Number 1, the board approved the department's alternative to custody program located at Gateways Mental Health Center. This is a 42-bed facility for people who are in custody and gives us an opportunity for those who were within 6 months of serving their sentences to bring them back into our community and allow them to serve the remainder of their time in a community-based setting to get ready for being released from jail. And it's the beginning of what the department is attempting to do to provide more humane services for people who have a mental health issue and are coming to the attention of the criminal justice system. So that's number 2. And number 3, we had I don't know if you saw it, but Mayor Garcetti asked for a press conference, kind of a unique and novel event. It was the mayor of the city of Los Angeles asking to have a press conference at a county Department of Mental Health facility. And it was held yesterday morning at Downtown Mental Health Center. We had Mayor Garcetti, Chief Beck, Supervisor Solis, Supervisor Ridley Thomas, all speaking about the partnership between DMH and law enforcement, through which we put together our SMART teams, in this case, and those are the partnerships between LAPD and Department of Mental Health to form these SMART teams, collaborative teams, to respond in a more sensitive and humane way to encounters between police and people with suspected mental illness. So the mayor wanted to announce that they're expanding their teams. We're going from 16 SMART teams to 32. We're doubling them. And we actually also have 8 camp teams that provide the ongoing case management and follow-up for people that are seen by SMART. But I should note that those teams are only one piece of the overall expansion of mental health and law enforcement teams that DMH is in the process of implementing. We're partnering now with 25 cities in Los Angeles And you have in your summary the expansion using SB 82 funds. So to police departments in Alhambra, Azusa, Bell Gardens, Culver City, Covina, Downey, Gardena, Glendora. Anyway, you've got it in your handout. And there's more to come. We're terribly excited about this because these teams, in addition to providing more service, we provide successful service. When these teams go out, we've seen over 4,000 people in our LAPD collaborations last year, and only 48 times out of those 4,000 visits, only 48 times did that encounter result in an arrest. The rest of the time, people were diverted to mental health care, either in a psychiatric emergency room, or now more recently, increasingly, in our urgent care centers, and that is a wonderful thing. So more to come on that, more expansion to come. It's wonderful. We are terribly excited about it, as well as the urgent care expansion. We're finishing up that, and again, you've got it in the update in your handout, but we will soon be going to the board with recommendations about 3 of the 4 urgent care centers. We have proposers for the urgent care centers on the campus of Harborview CLA Medical Center, in Long Beach, and the San Gabriel Pomona area. Yay for Service Area 3. We did not get proposers for the Antelope Valley, but we, thanks to many of you, including Commissioner Cooperberg, we are hot on the trail of some options, and I'm hoping soon to be able to bring you good news about the Antelope Valley. So it's a challenging time, I think, for the department, but we have a great team, and I'll ask Dennis and Brian if they want to add to the report in a second. But you know, lots of challenges, lots of hard work, and lots of sadness still about Dr. Southard's retirement. But we push ahead. We have had 3 remarkable successes just in the last 3 weeks, and we continue forward. This is going to be a good year for us, for all of us.